Hello and welcome to Doctors on TV. I'm your host, Dr. Sarah Barba-Cabodil, and I can't wait to share today's episode with you. Dahil dito po sa ating programa, we'll inspire and motivate you to make positive changes for your physical, mental, and emotional well-being. Pero naku, bago po ang lahat mga kasangbahay, kayo ay aming iniimbitahan na i-follow and i-subscribe po ang aming mga social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions and comments po sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Marami sa mga kababaihan ang nangangamba kapag may bukol na nakakapas sa kanilang mga dibdib. Lalo na po tuwing may period ang isang babae at karaniwang may nakakapang parang mga kulani sa paligid ng ating mga dibdib. At ang marami pa pong kababaihan ay naiisip agad na ang nakakapang bukol ay maaaring breast cancer. Naku, wag agad po tayong mag-jump into conclusion. Mga kasambahay, naku, dahil may condition po na tinatawag na fibrocystic breast. Ano nga po ba ito? Panoorin natin ito.
Do you know that fibrocystic breast is a non-cancerous breast condition that affects millions of women worldwide and is the most commonly diagnosed benign breast disease? But medical professionals no longer call it a disease, but rather fibrocystic breast changes. This condition affects a significant percentage of women, with estimates ranging from 30% to 60% of all women. It is most commonly observed in women aged between 30 to 50 years.
Ako kaya po paalala sa mga kababaihan, it is better to always consult with your physicians at wag na pong mag-self-medicate sa tuwing may pagbabago sa ating mga katawan. Lalo na pag ang ating mga breast o dibdib ang pinag-uusapan. And for deeper understanding about this, stay tuned. Doctors on TV will be right back. Welcome back to our show. In this discussion, we will also address common misconceptions surrounding fibrocystic breast change. Throughout today's episode, we will explore the causes and risk factors of fibrocystic breast. And for us to understand this, we have invited a distinguished surgeon who plays a vital role in the field of medicine and is skilled in a wide range of surgical procedures that span from routine to complex. Let us welcome Dr. Victor K. Gozali, a general surgeon from Makati Medical Center. Hi, Doc Vic. Good morning and welcome to Doctors on TV.
Hi, good morning.
Yeah, and thank you at pinaunlakan nyo kami here. No, marami po tayong matutulungan sa ating pag-uusapan ngayong araw. And let's learn all of the misconceptions from Doc Vic. So, let's get started. Eto, Doc Vic, now, please expound more what fibrocystic disease is, please. And clarify why is it no longer called a disease.
Okay. First, you have to understand fibrocystic breast, or now they call it fibrocystic change of the breast, is not cancer. So it is a benign condition. Okay. So it is one of the many forms of benign breast diseases like fibroadenoma and then breast cysts and fibrocystic change of the breast. Why it is no longer called as a disease? Used to be, they call it a fibrocystic disease of the breast. But now we realize that it is not really a disease. It is just a changes in the breast that leads into a formation of fibrous and cystic. So altogether, they call the fibrocystic change of the breast. Well, actually common among women. Well, you know, the most common presentation of fibrocystic change of the breast is a lump and a pain. So, well, I do not know if I have to start expounding further that it is usually associated with women's cyclical or menstrual cycle.
I see. Okay, so you mentioned na it's benign, ibig sabihin hindi naman nakakatakot as compared, of course, with the malignant ones. Pero, Doc, you mentioned that, well, though this is not a disease, this is actually a change. Does this condition, or does this change contribute to a formation of a disease or not really?
Fibrocystic change of the breast per se is not a disease, no? It's just a changes.
Yeah.
Okay. Now, the issue is because sometimes they present like a lump. Now, that is the problem. When you have a lump, you have to make sure it's not cancer. See? So that's why I will expound further later for the audience to see and to feel their own body. And then there are changes in what you feel, then that's the time you need to consult a physician.
I see, but are there like predisposing factors for certain group of women, for this change?
No, it is a normal changes of the breast among women, especially during their reproductive years, no? Meaning premenopausal. So what is that? Is on the average for fibrocystic change of the breast, is between the age 30 to 50 years old. That's where the occurrence happen. And if you want to put into numbers or statistics, has shown that 85% approximately, 85% of normal women will experience this.
So even the normal women really can experience this. Okay, and usually upon coming to your clinic, what would be the manifestations of these patients who have this fibrocystic changes?
Usually, patient comes to us with this kind of possible diagnosis. The most common is breast pain. So, and commonly people connote breast pain into breast cancer.
Yeah, so it instills fear, grabe, di ba? Dok, parang natatakot na yung mga tao, yung mga babae na, naku, masakit, baka ako ay may cancer na.
Correct. So actually, if you look at the statistics on breast cancer per se, the breast pain happen in the breast cancer is less than 10%.
Versus
the fibrocystic, 80% of fibrocystic change of the breast will present as a breast pain, 1 second tenderness. They feel masakit.
Pag hinawakan mo, tsaka masakit.
And of course, the third is the lump. So parang mayroon sila thickening in the breast. They feel parang bukol.
So when you think about it, mas nagpapanik pa yung mga hindi naman cancer yung meron versus sa may mga breast cancer. Okay, and kanina na-mention natin, usually one of the predisposing factors would be, just being like a regular woman, like within the reproductive age between 30 and 50. And pero what actually is the deeper cause of this, Doc?
Well, for fibrocystic change of the breast, because I mentioned earlier, it's cyclical, right? It's a cycle, monthly. They feel discomfort, they feel, that's why they come and consult you. So the cause is, if you look at it, is really specific cause, nobody knows, but experts is pointing towards a possible hormone factors, like estrogen. The female hormone, the estrogen hormone is, if you follow the cycle of a woman monthly, so the mid-cycle is where the estrogen hormone or progesterone is a little higher. And then as you go closer to your next mens, it goes down slowly. Now that's why at the peak, that's why the breast pain usually happen in the 7 to 10 days prior to the next mens. Because that's the peak of where your estrogen was.
I see. And a while ago, di ba, we mentioned during the reproductive period po, age of the woman, nangyayari siya. I mean, but does these occur also among menopausal women?
Because of that changes, as we put the culprit as the estrogen. As you know, when it is postmenopausal or they are in menopausal stage, it decreases the estrogen level, right? So some of those fibrocystic will disappear. So, but of course there is no fast rule. You still can have fibrocystic among women postmenopausal.
I see. And Doc, at what point should a woman be worried if she has experienced fibrocystic breast change?
Well, number one, the women should be able they should know their own breast. So you have to examine your own breast
Regularly.
preferably it's 7 to 10 days, or day 7 to day 10 after, day 1 is your first day of mens.
Yeah.
So you examine your breast day 7 to day 10. Alright?
That is the perfect timing.
Right. Supposed to be at the lowest, and then less tender. And then when you notice there is a new things which is not usual, then you should be worried. You should consult your doctor.
I see. So having mentioned that, it just means that a regular clinical breast examination can be one of our diagnostic procedures.
Correct. And then one of the, just add, sometimes a nipple discharge. Fibrocystic change can also produce some
really?
nipple discharge. That's why when you examine the breast, then you make sure you not only the periphery but also the periareola and the nipple.
Essential part.
Yeah.
Okay, and apart from the regular clinical breast exam, I mean, what do you usually request for these patients?
Well, generally, you give some assurance if you think it is benign, no? So, but of course, your physical exams only plays around 50 to 60% accuracy, no? So you should complement it with diagnostic, like for example, mammography. That is for women older than 40 years old and older.
Okay.
Now, if they're younger, usually we prefer breast ultrasound. So, if breast ultrasound will gonna be your diagnostic modality for women 25, of course, until even older. No?
But how regular should you be, or should you be subjecting the patient to these diagnostic procedures?
The standard for mammography is you have a screening and diagnostic mammography. For screening purposes, at the moment, the recommendation is 40 years and older. You can have, the recommendation is yearly. But for me personally, when the mammography reading is benign, I just ask them every 1 or 2 years. And for ultrasound, if you are monitoring something, then you can have it every 6 months or maybe once a year.
When do you require a fine needle aspiration biopsy, or do you really request this for this
Well, first you
condition?
should have a guide. Why do you do fine needle aspiration biopsy or even aspiration? So you should have an ultrasound first. So you make sure you identify a mass or a cyst. Then that is the one that you will do fine needle aspiration. Okay. So if the ultrasound shows there is a cystic mass, cystic meaning there is a fluid, then you do. When it is big, you can do it blindly. If not, ultrasound guided. No, and then you aspirate. Now, if it is a clear fluid, generally it's a simple cyst. But when it is cloudy or bloody, then probably suspect for other things. So that fluid subject for cytology examination. Okay.
So i-inspect ano po yung laman nitong itong specimen.
Tapos pagdala mo sa laboratory, para ma-check nila kung meron ba cancer cell or just simple.
Ito, Doc Vic, many patients or many individuals, should I say, are afraid of this kind of procedure, yung fine needle aspiration biopsy, kasi they are afraid na if, of course, meron yung fine needle na gagamitin, and then upon poking or inserting dito sa gitna ng mass, is there really a chance of, if there is a possibility, a chance of malignancy, so is there really a chance of parang scattering or
No. You are saying about if fine needle aspiration, we only make use of yung hypodermic needle, yung 5cc, to engage 23. No, it will not spread. No, but the other form of is doing core biopsy, right? That you get a tissue. But for fibrocystic, usually
not really.
just simple.
Okay, so dapat hindi matatakot mga kasambahay. Okay, so mas matakot tayo pag hindi na-diagnose ka agad ng doktor at hindi manage. Especially if we're considering here a malignancy.
Yes.
Okay, naku, ito ang dami na natin na pag-uusapan, Doc Vic. Ito mga kasambahay, naku, marami pa po yan, ha? Okay, and we all have to remember, mga kasambahay, knowledge is power, and by understanding fibrocystic breast, you can alleviate anxiety and take active role in your breast health. Marami pa po tayong dapat malaman at pansamantala muna po nating ititigil ang ating talakayan. Kaya wag niyo po ililipat ang channel. Doctors on TV, we'll be right back. At para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Victor Gozali, a general surgeon from Makati Medical Center. Eto, Doc Vic, no?
Yes.
Okay, sa ating pagpapatuloy, this time around, we'll be discussing yung mga preventive measures, okay? So, I mean, are there any lifestyle changes that we can recommend sa ating mga viewers which can help in controlling the symptoms of fibrocystic breast changes?
Well, the prevention, maybe you heard people say, you avoid coffee, di ba? Mga ganyan, caffeine or chocolate. Yes, study has shown that those lifestyle change, meaning avoid drinking coffee or if not minimize, and then chocolate, and then sabi nila even tea. The purpose not to prevent the formation of fibrocystic change, but the purpose is to decrease the discomfort. Okay? Because people think, oh, if I avoid that, it will not happen. No, but it will decrease those signs and symptoms. Okay? So people more comfortable. And then second, they said prevention. Yes, you can supplement with vitamin E. Okay, vitamin D, yung mga supplement. The same thing is actually not to prevent because as I said, diba, it's a normal changes eh.
Yeah.
So, and the other is regular exercise. Regular exercise is not exercise for the breast. You know? So, exercise of simple walking is fine. Okay, so yun lang, timing mo lang. Why? Because when you do exercises, then, di ba, yung systemic circulation nagmo-move, including lymphatic circulation.
Yes.
Now, when lymphatic circulation is also mobilized on the area of the breast, to minimize yung breast swelling. Di ba? Breast swelling, breast discomfort, regular exercise, then you feel much, much better.
Yeah, and of course, maganda rin yung minention nyo about physical activity because it also helps in, balancing the hormones.
Correct. Yeah.
And kasi you mentioned a while ago, of course, na it's basically during the peak of estrogen, that's when mas na-experience ng patient.
Yun lang yung exercise, hindi naman kailangan pupunta kayo sa gym, no?
Kasi madami nag-enroll sa gym pero hindi naman nakakapunta regularly. So,
saka delikado din pupunta sa mall, walk and walk, kasi magastos pupunta, di ba?
Tapos kakain, nagbi-build up ng weight and, hormone issue.
When you go to work, instead riding a Grab o you walk na lang kung hindi malayo. Kasi that's a form of exercise. So, yung ginagawa yung iba, they bring baon of their clothes or their uniform, and then they exercise. When padating nila sa office, di ba? O sana, they change. That's how they do it in America eh. Di ba? They go with rubber shoes, go to the office, na-train sila, nagaganyan. Actually, exercise yun. At parating sa office, kung ano yung form, kalit mo lang.
Pero dito sa atin, hindi tayo masyadong ganon.
Ayun lang. That's why I was saying, kasi mahal yung exercise if you go to the gym, you go to the
The important thing here is yung sustainability. Dapat tuloy-tuloy mong magawa. Okay. Eto, Doc, sa treatment naman. Okay, so, and how do you manage this condition, yung fibrocystic disease, breast changes?
So, di ba, usually in presentation, the most important is, first is assurance. Because sometimes a lot of these things happen because it's in the mind, right, of the patient. I'm afraid of this, and then, but then they talk to their doctor, they give some assurance, it's not cancerous, it's not, and they feel at ease. That's already 50% of the treatment. Now, the other is you have to supplement it with, let's say, breast pain. So, give pain reliever, like biogesic, simple lang. Paracetamol, or even ibuprofen, okay? As needed basis. Okay. There are some cases that, they've been trying with those things, and then they come back to you after a month or so, still wala, ganyan, okay. When, in general, when they have persistent breast pain for more than 3 months, usually we give hormonal treatment. They call it tamoxifen. It's an anti-estrogen. Di ba? Alam natin, this fibrocystic has something to do with the estrogen hormone.
Yeah.
So you counteract it, tamoxifen, which is an anti-estrogen, 10 milligram once a day. Okay. Now, they go to the botica, and then bumili sila tamoxifen. You know, sometimes these pharmacies or ano say, bakit may cancer ba kayo? Because tamoxifen is also being used for breast cancer. But the dosage is 20 milligram. So for fibrocystic, you give 10 milligram once a day for 1 to 3 months.
And then observe.
Then observe, you stop. Unlike in breast cancer, you give them for at least 5 years. Okay? So, but people, I had a patient, they came, Doc, sabi niyo may cancer daw. Null! Sabi ko, kasi that is, but you only reserve that drug. And it usually works.
Okay.
And then, of course, the other treatment is avoid yung mga, ano, di ba? Coffee, caffeine, mga exercise.
Yeah.
That is part of it. No?
Is surgical excision indicated for fibrocystic breast change? And when is it indicated?
Generally, fibrocystic does not need any surgical intervention unless one you suspect there is a possibility of malignancy. Okay.
Based from the imaging studies.
Yes, yes. Because when there is, di ba, pinamamography or ultrasound natin.
Yeah.
Now, lumabas is BIRATS 4. Di ba? If you understand, the BIRATS is a classification saying whether they are suspicious or not suspicious.
Malignancy.
BIRATS 4 is suspicious for possible malignancy. So the next step is biopsy. Now, sometimes they do a surgical excision, surgery. Okay, and then, why? Because one is suspect. In the biopsy, you will get the breast tissue and the cyst wall. Diba? Fibrocyst ito, you're not talking about breast cancer. Kasi fibrocystic, so there is a cyst. So the cyst wall can be examined. Okay. The second, diba, the first treatment usually, you just aspirate and aspirate.
Yes.
Okay. When you keep on aspirating more than 3 times, don't you think that the best time is remove it? So where the surgery comes.
Okay, so in the event, Doc, that, okay, so kung kunyari mapilit din the patient, ito nga, and surgical intervention na, okay, and usually, how long is the recuperation period, and what are the post-surgical care?
Yeah, it's like if the surgery is done. Now, the wound healing you're talking, the wound healing is, normal wound healing is 1 to 2 weeks. So, common, they tinatanong na, Doc, after the, remember this is a minor operation, hindi ito major operation. Kayo po, hindi kayo kailangan ma-admit. It's an outpatient. Pwede naman local anesthesia o pwede din under sedation. Okay. So, tinatanong yung pasyente usually, bukas pwede ba ako pumasok? Yes, pwede. Number 1. Number 2, and I advise them, you wear bra. Because people are afraid. Diba? Baka mamaya hindi. Kasi may ghost naman yun eh. So you wear bra. Because the bra will support the breast. No? Unless you want to sleep, you're not comfortable, it's up to you. But
That's
when
when
you, during the day, you wear your bra. Kasi they are
It's
afraid
okay.
Oo. So the wound healing happen 1 to 2 weeks. So you're gonna have a follow-up sa doktor nyo. And then tatanggalin yung tahi, usually 7 to 10 days. Okay? But hindi po kayo kailangan mag-absent for 2 weeks.
Minsan may maghihingi pa ng medical certificate, patagalin, diba?
Tinatanong na, Dok, gusto ko 2 linggo. Teka, may doktor din sa company mo eh. Baka ma-question tayo. Sabi ko, di ba? Kung 3 days, reasonable na. Kasi, alam mo, Dok, kasi kailangan ako mag-jeep, ganyan. Oo nga, sige, 3 days, reasonable. But yung iba, excision lang, humingi 1 buwan. Sabi ko, pangalan ko yan eh. Sabi ko, hindi, di ba? Kasi may doktor din sa company mo eh.
And naintindihan din nila how benign, how
tama.
simple the condition is, di ba? Naku, malalagot naman si Doc Vic.
Naku, kay Gozali pala ito.
Eto, Doc, what advice can we give dun sa mga natatakot ma-diagnose ng fibrocystic breast changes?
Number 1, the advice is, as I said in the beginning, you should know your own breast. So you have to examine your own breast and be familiar. You know, when you examine the breast, remember 6 area, okay, 4 quadrant, and then periareolar and the nipple. Yourself, ito naman eh.
So, the quadrant, Doc, iyan natin sa viewers. So, basically, divide natin sa 4.
Apat.
And then, dadagdag natin yung nasa gitna sa labas ng nipple.
Tapos
and
you press a little the nipple, kung may discharge. Okay? And, kilikili. Okay. Parang to see kung may kulani.
So, dapat yan nakataas ba yung braso, Doc?
Yes.
Pag kinapa?
Pwede naman nakahiga. Pwede din when you take a shower. Diba? May soap eh. Makakapa mo yun eh.
And you mentioned a while ago, the perfect time would be, kumbaga, day 1 ng mes, so yung day 7 to 10.
10. Yes.
Okay.
Yes. Ganyan.
So,
That's
dapat,
one. By second, if you feel anything new, kung meron kayo nakapa o na-notice, ito wala, ito last month na, then puntahan nyo yung doktor. Hindi ibig sabihin cancer yun ha. Actually, pupunta lang kayo sa doktor nyo para to seek advice. Kasi sila professional. Okay. Tapos, yung kayo po, yung 40 years and older,
ako ba yun, Doc? Nakatingin ka sa akin.
Hindi. Kasi you are 40 years and younger. So, yeah, dapat mag-regular na kayo visit to the doctor and have a mammography or ultrasound. Because that is the purpose. It is recommended is to discover them when it's early, if ever. Huh? So, as far as fibrocystic, of course, the other advice, minimize mo yung drinks of coffee.
Mga
diba?
bawal.
Bawal. O yung fatty foods. No? And then, sabi nila, salt, di ba? Salt kasi can produce your tissue swells, na? Kasi water retention eh.
Yeah. Where salt goes, water
but actually,
follows.
studies said it's not the salt for breast, fibrocystic. It's sugar.
Oh, sugar.
Yes. The sugar, that's why avoid mo yung very sweet. Or kayo yung may sweet tooth, no? It has some change, for fibrocystic change of the breast and discomfort. So, minimize mo yun. So, no? So,
sabi na, natitig ako sa inyo, parang,
alam ko,
sweet tooth ako eh.
Yeah. I mean, most of us, especially women, di ba?
Yeah.
Talagang sweet tooth yan eh.
Okay.
Kumukuha sa palagi may dessert, di ba?
At saka siguro, Doc, tama ka. So, of course, yung maintaining a healthy body weight, no?
Right. Yeah. Iba yung salt water retention in other part, not only the breast.
Not on the breast.
Yes, it's more of sugar.
Ang dami ko natutunan sa'yo, Doc. And I'm sure yung atin din mga kasambahay. Eto, Doc, sige, ano po yung final words natin sa ating viewers?
You have to know yourself, your own body, di ba? Number 2, do not hesitate to seek consult, di ba? Pwede naman sa doctor's clinic or kahit nasa center. Yung importante, yung regularity. Kasi yung attitude natin yun ugali natin yun Kasi pupunta lang tayo kung may problema sa health natin or magsa-self-medicate. Di ba? Hanggang hindi na maayos, that's the time they go. Wrong. Kasi dapat yung regular. Ito women usapan ito tungkol sa breast. So, breast is number 1. Breast cancer Breast cancer is the number 1 among Filipino women. The data has shown, the last 2020 data by WHO, is up to 26% of Filipino women has breast cancer during their lifetime. You can imagine, out of 4 of women.
Yeah.
So that's why I was telling my patient, when you are in the elevator, 10 kayo, probably 4 of them have breast cancer. Nobody is telling everyone, di ba?
Nakakatakot yun. Kunyari, 10. Isa ba ako dun sa 4? Gusto ko yata dun sa 6.
No, what I'm saying, yung
or pwede mo maghanda na lang ako, Doc.
Yung awareness. So that's why, for fibrocystic change, okay, I did not, just add lang, no?
Yeah.
Can fibrocystic change become a cancer? Okay. The answer is yes and no. Generally, no. But if you have a family history of breast cancer, yes, there is a possibility that fibrocystic change might lead transformation to malignancy. They have a 2 to 4-fold increase of risk of developing breast cancer. So that's why a person who were diagnosed to have fibrocystic change of the breast at one time during the be aware if you have a family history. Okay? You have to be more vigilant, you have to be more follow-up, or what things like that. Because, yes, there will be a transformation. Some books says if within 10 to 20 years after the diagnosis, fibrocystic change might lead to breast cancer in high-risk patients.
Okay. So,
that's
now
another information.
so, now it boils down pa rin dun sa early diagnosis would mean early management. And of course, the importance of self-care.
Correct.
Okay, thank you, Doc. And you might want to invite our viewers to visit you here at Makati Medical Center. What do you have to offer here?
Well, yes. Actually, I'm the executive director of the Makati Medical Cancer Center. And you are always welcome to seek consult. You can go to information, or you can ask your friends who are, doctors in Makati Med for consultation. Now, as far as diagnostic modalities, even though you don't have any doctor or you know any doctor Makati Med, but the diagnostic center can provide you like mammography, ultrasound, breast MRI, diba? And then we have the 3D mammography, mga ganyan. So, as far as the breast is concerned, there is specific, the breast clinic in Makati Med is a dedicated center. It's not mixed with other diagnostic like chest x-rays, So, sa Makati kasi specific. Of course, nobody wants to know about cancer, but we not only treating cancer, but also non-cancerous lesions. Okay?
Thank you very much once again, Dr. Victor K. Gozali, a general surgeon from Makati Medical Center.
Thank you for Dr. Sara for giving me the opportunity, and of course to the crew of the UNTV. They are so nice.
Thank you very much. It's
Thank
our
you.
pleasure, sir. Okay, and we hope mga kasangbahay, marami po kayong natutunan sa ating mga natalakay kanina. Pero naku, hindi pa po nagtatapos diyan. Let's just pause for a break. Doctors on TV, we'll be right back. For so many reasons, healthy diet can help reduce risk of getting sick. And now, let's have some captivating exploration about good breast health. To know more about this, let's watch this.
Good morning mga kasambahay. Sa mga kababaihan na nanonood ngayon, kayo ba ay minsan may nakakapa sa inyong breast na maliliit na lumps o di kaya ay bukol na para namang may lubid at ito ay nauurong o nagagalaw? Kung meron man ay huwag agad magpanik dahil maaring yan ay tinatawag nating fibrocystic breast change. Ano nga ba ang fibrocystic breast change? Ito ay ang dalawang bagay na pwedeng mangyari naturally sa breast. Fibrosis means madaming breast tissue na parang peklat or matigas or rubbery. Ang cyst naman ay fluid-filled lump or sac. If fluid builds up, pwede itong ma-stretch ang mga surrounding tissue. Ito ay masakit pero hindi harmful. Although it may happen naturally sa ibang kababaihan, may mga natutukoy na pagkain na pwedeng mag-cause nito. Ang maaari nating tutukan, lalo na po yung mga babae na meron nakakapa o nagsisimula na fibrocystic breast, ay number 1, yung po ating kape. Naku, nakakalungkot man kasi yung pong kape ay merong methylxanthine na pwede po mag-build up at lalo mag-cause ng swelling, inflammation at mag-build up ng mga lumps or mga cysts na nakakapa po ninyo. Pangalawa, kung kayo naman po ay heavy, lalo na po dun sa mga fats, fatty foods, or mga lipids, lalo na po yung mga saturated foods, ito po ay nagtitrigger ng sobrang hormones, lalo na po yung estrogen natin, na pwede mag-build up or mag-cause ng inflammation, or mas lalong lumaki, or magkaroon ng pamamaga, or magkaroon ng pananakit ang ating pong breast. At syempre, at dapat iwasan ng mga kababaihan ay ang pag-inom ng alcohol, lalo na po kayo ay kung mga nasa age na mga critical, lalo na may mga hormonal imbalance na kahit anumang alcohol ay hindi po pwede sa inyo dahil magkukos po ito ng mga inflammation at syempre magkukos ng mga free radicals para po yan ay ma-enhance at lalo pong mauwi sa isang problema. Bagamat ang fibrocystic breast ay hindi masakit, nagkukos ito ng pain and discomfort. Gawin niyo ito para mabawasan po ang ating sakit, lalo na po sa mga kababaihan. Number 1, syempre, kung kayo po ay babae, avoid contact sports and activities, lalo na po yung mga activities na pwedeng tamaan that could affect your breast. Of course, syempre, kailangan din po natin wear a sports bra, especially when you exercise or meron po kayong mga ginagawa when you breast feel extra sensitive. It may help also to sleep in one kung kailangan nyo po yun. And then put heat or ice in painful areas. Kailangan na po nating i-hot and cold compress, lalo po kung may nakakapa at gumagalaw at lalo na po merong pain. And of course, napaka-importante po, you have to take an anti-counter inflammatory drugs like ibuprofen, or you can ask your medical practitioner kung ano pong pain reliever ang pwede sa inyo. And you also wear a good quality supported bra that fits well and even your dress daily. And then you always need to lower the amount of your fat in your diet kasi it will trigger ng yung pong pag-production ng mga estrogen, mga hormones na magti-trigger na mas lumala ang iyo pong nararamdaman. Paalala lang mga kasambahay, hindi po porke may nakapa kayong bukol o di kaya po may napansin kayong pagbabago sa breast ninyo, ay babaliwaliin lang natin agad o isisipin natin na yan ay fibrocystic breast lang yan. Mas maigi pa din po na kumonsulta agad tayo sa ating mga doktor or sa mga espesyalista. Sana po ay marami kayong natutunan sa episode natin. See you again next week for more natural tips. Muli, ako po si Doc Bunny Bernardo, isang naturopathic medicine practitioner. Please follow my social media accounts, yung pong Eleuterio Bernardo, because natural is beautiful only here at Naturally Yours.
And there you have it. Before saying goodbye, I would like to greet my kambal, Iyo and Iya, and also kay EJ and Doc Aline. And Nanay and Tatay, I miss and love you both. As we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their continued support. We hope you enjoyed our show and found it informative and gained a proper understanding on today's discussion. Remember to follow us on social media for updates and don't forget to tune in next time, God willing. Muli po, maraming salamat sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
Watch these snippets for the upcoming episode on Sunday.
What's really the importance behind breastfeeding? Because, it's so much easier to prepare formula sometimes. It takes more effort sometimes to breastfeed, but there's so many benefits with breastfeeding.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza Soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can also be used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-423133 or 02-8824-5217 or 02-8813-0320. Adlaon Optical, located at ground floor Super 8 Warehouse, Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Maykawayan City, Bulacan, 0922-861-2095. Organic Acai. Support your health with 100% organic superfood supplement, Organic Acai, Premium Blend, and Acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic Acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360. Or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura, you may contact them at 0917-317-7272. Medical Depot. Healthy Num Num Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow their Facebook page, Dr. Sara Barba-Cabodil. Special thanks to Dr. Gia Grace B. Son, Head of Makati Med Wellness Center, Attorney Pilar Nenuca P. Almira, President and CEO, Dr. Saturnino P. Javier, Medical Director, Ms. Arlene L. Sanco, Senior Vice President, Ms. Monica Reyes Dizon, Assistant Vice President, Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.